most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We're the most famous physical therapists on the internet.
In our opinion, of course, Bob.
And this is not really a physical therapy topic, but I'll tell you in a minute why we're doing it. Number one treatment for tinnitus, it's supposed to be said tinnitus, based on science, in our opinion.
Not tinnitus.
Tinnitus is how the layperson says it.
Okay.
The professional says tinnitus, so
Okay.
that's what we're going to say. I felt compelled to do this video because I've been seeing a lot of basically what I'd call scam videos.
Mm-hmm.
You know, they're telling you how to get rid of tinnitus in one easy treatment or whatever,
Sure.
and that's just not true. And I think it's really important to educate yourself using reliable sources. So I thought this video would be kind of a mixture of, one, how we go about looking at things,
Sure.
and two, giving you some really solid advice on how to handle your tinnitus.
And then point some directions to get more information.
To get more information, right. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, we're giving away, once again, a SleepOvation mattress.
Oh, great.
This is not the full mattress, is it, Brad?
No, but it's a nice sample of how they're constructed.
Yeah, so they had 700 minis mattresses, and they really provide pressure relief if you're having neck pain, back pain, shoulder pain, hip pain, knee pain.
Oh, yeah, they're comfortable.
So, by the way, if you go to bobandbrad.com, go to the giveaway section, or go to Facebook, Bob and Brad, it's pinned to the top of the page.
There you go.
So,
and that'll take care of it.
that'll take care of it. All right. So, the sources that I looked at is, first off, usually if there's an association. So there's the American Tinnitus Association.
Sure.
So you know they're going to be reliable.
Yep.
There's the British Tinnitus Association.
Okay.
So I got some information from them.
So these are groups associated with the medical community,
Right.
research,
Right.
some good science.
Yeah, they're not going
foundation.
to steer you the wrong way.
Sure.
I always go to the Mayo Clinic website, not
Yep.
only because I'm an alumni, but also because they have solid
Right.
information. You can trust it.
Right. They've
So-
got a great reputation.
Right, great
to say the least.
reputation. And then I always check PubMed, which is research that is sponsored by the government. I mean, the site is sponsored by the government.
Sure.
And I always look there for the latest research and see if
Mhm.
I can find anything.
Yep.
So, tinnitus is the perception of noise or ringing in the ears. You can have ringing, buzzing, roaring, clicking, hissing, or humming. So any one of these sounds. It affects this. I think you're going to be surprised about this, Brad. 15 to 20% of the people, about 50 million Americans.
Really?
Isn't that amazing? That's
Right,
a lot
right.
of people.
I'm
And
assuming to different degrees.
it does. There's they said about 2 million where it's so severe it's almost crippling.
Wow.
So it's important to see your doctor,
Mm-hmm.
who may send you to an audiologist. There may be physical reasons, or like you talked about Meniere's disease.
Sure.
You could have wax in your ear. There's reasons why it might be there, but in most instances they cannot come up with a reason why it's there, although it's highly associated with hearing loss.
Okay.
So
Sure.
there is no cure, but there are treatments available to lessen the symptoms.
Sure.
And that's what we're going to talk about today,
Okay.
and make it easier to live with. So some of the treatments to consider, I'll talk about the one that I think is the number one in just a minute, but some of the things to consider: you can use hearing aids to increase the external noise,
Sure.
so you're not picking up
Or
on the internal.
overpower.
Yeah, kind of overpower it, right?
Mhm.
Or you can mask the sound by using like sound machines or a radio or something like that.
Sure.
So obviously, you can't rely on that because I guess you could with a hearing aid, but you can't always have the external noise
Right.
playing for you.
Right.
So the best approach to me and this was research based and recommended also on the website, the ATA.org. I'll have these linked below.
Okay. So it's gonna. Well, they can go to it.
They
and
can
look,
go and look
our viewers-
themselves.
Yep.
Is basically what they call mindfulness, which is frequently used in meditation.
Sure.
So, mindfulness is actually a state of open attention on the present. So they don't really want you to ignore the sound. They want you to pay attention to the sound, and actually eventually you can actually, through what we call habituation.
Mhm.
Brad and I have used this with people who have dizziness. Like if someone has dizziness, we keep exposing them to the dizziness, and after a while it starts to lessen because of that.
So they acknowledge it, but become desensitized to it, so it's not such a overwhelming.
Sensation.
Right.
I think the example I saw that was really good, Brad. you know how your refrigerator might be buzzing, but after a while you can block it out,
Right.
you know, or a
Sure.
light might be buzzing.
Right. People live by the railroad tracks initially just
Yeah,
you
right.
can't sleep with it, but eventually you acclimate to it.
Yeah, one for me lately has been these birds wake up in the morning, you know, and we like to have the windows open and like, well, I'll just accept it. It's beautiful. There's birds singing there,
Yeah, yeah.
and now I'm to the point where I can sleep right through it.
Oh, I
So
thought you said you were gonna get the shotgun.
yeah, I'm gonna get the shotgun. No, we're kind people. We don't
Right.
shoot birds.
I actually love the birds.
Yeah. So anyway, that's the recommendation we're going to have, and they have some websites that work out really well for this. One is called mindfultinnitusrelief.com, and they have a great research section. Again, I'll have the link below
Sure.
that shows all the research. And I went to PubMed and found a lot of these same
Yep.
research articles.
Sure.
So
Right.
they're the real deal. Um, the other one is they had a couple podcasts on that website.
Okay.
One that was by Jennifer Granz, PhD, and there's also one by Bruce Hubbard. His is a little different. He goes on cognitive behavior therapy.
Okay.
I'm not sure, real familiar with that, but
Right.
so both the approaches use that habituation.
Sure.
And you know, again, I like the three things about it. One, it's research based. Two, it's got additional benefits. You know, meditation is going to help you with your stress levels.
Right.
And if you do rumination, you
Sure.
talked about,
Yep.
if you tend to run thoughts through your head over and
Over
over
and
again.
over and over, and builds up into.
Yeah.
Yeah. It's like being married. Just kidding,
Brad,
Bob.
you're
Just
gonna
kidding.
you're gonna have a lot of stress
I
there.
know.
By the way, yeah, if you there's a book called Tribe of Mentors by Tim Ferriss where he interviews really successful people and they give advice.
Sure.
Vast majority of them use meditation in their life.
Yeah.
So it's really a highly recommended.
Right. It's one of those things you actually have to practice and
Yes,
work
you
with,
do.
and
Because you've done some of it, right? Years ago.
yeah, to a degree.
I feel like
And
I
like keto.
don't do it now, and the reason I don't, I think I got things that are like meditation
Sure.
in my life that
Yep.
seem to help
Yep.
reduce exercise and stuff. But the final thing is there's no side effects from this. So why not give this a try? You know, learn to basically you're learning to live with and decreasing the symptoms as opposed to doing this tapping or pulling on your ear, this crap that they. Well, I'm sorry, it kind of upsets me when they try to, you know, I'm sure a lot of people are desperate for relief,
Right.
and to come up with this stuff that really doesn't work. So, all right, thanks everybody. I got on
Bob's
my
ready to.
soapbox.
He's about ready to.
That's right, I'm
explode.
ready. Yeah, I'm on my soapbox. So, all right, thanks for watching.